We're going to talk about celiac plexus. Celiac plexus is an autonomic nervous plexus. It's located in front of abdominal aorta. Fibers within plexus arise from greater, lesser, and least splanchnic nerves, and also contains parasympathetic nerves via vagus nerve. Its function is to receive both parasympathetic and sympathetic inputs from vagus and splanchnic nerves and convey to their respective postsynaptic outputs to the abdominal viscera. We're going to also talk about the advantage of ultrasound guided anterior approach to the celiac plexus. The main advantage is that no radiation exposure to the patient. You don't need to shift the patient to a radiology suite, and also it was injury to the nerve roots, which can happen in the posterior approach. And it's also suitable for the patients who cannot lie prone because of the abdominal pain or other reasons. So the limitation for the ultrasound guided approach would be it is very challenging in obese patients. If you have a big pancreatic tumor or intra-abdominal mass, then it may be challenging to perform it. And also if the mass anterior to the plexus is very vascular, then you should not go for the anterior approach to the celiac plexus using ultrasound. For the anterior approach, patient lies spine using a curvilinear probe over the epigastrium, just caudal to the xiphoid process. You've got a scan in both the axial and in the sagittal views. In the axial scan, you will see the vertebral body, you will see the aorta, which are our main landmarks, and then you can also see the hepatic artery and the splenic artery coming out from the celiac trunk. And also you can see the liver, you can see the inferior vena cava and the superior mesenteric artery. You can also have a sagittal scan to correctly identify both the celiac trunk and the superior mesenteric artery. And after that, you can use a 20 to 22 gauge needle, and you can introduce it in both the short and the long axis view, and the needle should fell to the origin of the celiac trunk. Then you do a negative aspiration to see any blood should not come out in the aspiration, and then you inject around 30 ml of 50% ethanol with 0.25% of bupivacaine. One can also perform a diagnostic block by injecting a local anesthetic before absolute alcohol. The complications which are associated with celiac plexus block are pain at the puncture site. There can be transient hypotension and diarrhea. The rare complications are hematoma formation, chemical peritonitis, abscess formation, visceral injury, and fistula formation. The paraplegia, which is seen in the posterior approach, is not usually seen with the anterior approach. Thank you.